Life, the national strategy to reduce suicide. It guides very much the work nationally that it is all being done in the area of suicide intervention, prevention, and postvention. But it also very much guides the work that we here do in the Midlands, and that's myself Josephine Rigney, who works in Laois Offaly, Patrick Jones, who's the resource officer for Longford Westmeath, and Rosalie Dolan, who's the resource officer for Loudmead, and they'll be coming on later on in the presentation to introduce themselves to you and introduce some slides. So we're all familiar with the aim of Connecting for Life. It's the whole of society strategy. The vision is to create an Ireland where fewer lives are lost through suicide and where communities and individuals are empowered to improve their mental health and well-being. And the outcome, which collectively all the actions that's contained within Connecting for Life, both on a national scale and a regional scale, is to reduce the rate of suspected suicide deaths amongst in the community, amongst the general population, and also amongst specified priority groups, and also to reduce the rate of presentations of self-harm as well in the whole population and amongst specified priority groups. The specified priority groups there are people that are, you know, by way of by means of their the various risk factors that may be present in their lives, and the research that was conducted when Connecting for Life was being developed would have categorized such people, because of their risk factors and because of the circumstances, as cohorts and demographics who may need more targeted approaches to help them to keep themselves safe, both from suicide and self-harm. So within Connecting for Life, there's 7 goals, and the aims of those are briefly, I'll go through them. The first one is to improve the understanding in relation to mental health and suicide prevention. The second one is to enhance communities, the capacity of communities to be able to recognise and prevent suicidal behaviour, and that will be very much reliant on the suicide awareness and prevention programmes that we roll out and coordinate within all of our areas. The third goal then is to focus on priority groups. As I mentioned, those particular priority groups, cohorts and of the population that may be more vulnerable to suicide. What are the targeted approaches that would be most helpful to them and help them keep themselves safe? The fourth goal is better access to support, ensuring that our the services that are provided by the HSE and within all of the organisations that we partner with and work with are more accessible and more consistent, and there's a greater integration between those services. The fifth goal there is ensuring that any services that are being provided are of the highest quality, that they're safe, and that when people access those services, that they can be assured that they're getting the most evidence-based and top quality service that they may need. The sixth goal then is reducing the access to means, working within all sectors of society to make sure that access to means is reduced, and therefore any impulsivity in relation to ending of life is reduced, and therefore there's more safety in our communities. And the seventh goal then is relation to better data and research, which is always necessary to keep that constant improving in relation to services. In the national strategy, there are 69 actions, and in the Midlands, Loudmead action plan and our strategy, which goes from 2003 to the end of 2024, there's 44 actions, and very much aligned to all those goals that I mentioned a bit earlier. And those 44 actions are across all sections of the HSE, both mental health, health and well-being, disability services, older persons, primary care, and even some of our statutory partners will have some goals there as well. And collectively, all of those goals are will ultimately hopefully lead us to that outcome of that was on the first slide in relation to creating safety and reducing the loss of life through suicide. To ensure that we constantly keep a focus on aiming towards the goal and the vision of Connecting for Life, there is an implementation and a monitoring structure within our CHO, Loudmead in the Midlands, and you can see there the various the structures there. So the overall oversight is with the senior leadership team of the CHO. So there's a quarterly report back to them every quarter to track progress, what progress is being made in relation to the actions, where are the barriers, where are the challenges, what can we do in relation to removing any of those barriers and challenges. There's a steering group also that's comprised of the general managers that you can see listed there on the right, and of the 3 resource officers. And our focus there is to keep that monitoring and implementation going, and to link both is between the local implementation groups, which are on the bottom there, and there's a local implementation group in each of the bi-counties, so in Laois, Offaly and Longford Westmeath and Louth and Meath. And some of you that are here today may be a member of those, and those meetings are being held. I think the first one is in Louth Meath next week, and then in Laois, Offaly the following week, and in Longford Westmeath the following week again. So those meetings will be happening soon, and we're very looking forward to getting started in relation to coordinating and being a part of those implementation groups, because they are the ones that are really giving us the evidence from the ground up, from what's happening on the ground, what are the needs, and also making sure that all of the actions are being developed and implemented. And so you can see the process there, so that will ensure that we keep that implementation and monitoring going. The 3 key messages that really hold the focus for the resource officer, for the 3 of our resource officers and our work, is that the suicide prevention is everyone's business, that we wanting to create that safety within our community, and also creating awareness of the supports and services out there. And we're going to focus on those 3 key messages now. The first one that is on your screen there is that suicide prevention is everyone's business. The theme of World Suicide Prevention Day is creating hope through action. And that really aligns to that. Suicide prevention is everyone's business. What can each and every one of us do to bring about safety in our community? And by doing that, we're creating hope. There is that hope that we can each individually play our part. The key messages of the World Suicide Prevention Day was reach in, reach out, and be the light. And they very much align with the key tenets, I suppose, of our work as resource officers, as we're doing all of the and even the actions as well that are in the action plan. That photograph there is of me that was taken recently in where Tullamore Goes Green. You're also familiar with the fact that this month is Sea Change, the Green Ribbon campaign has been rolling out all of September, and a lot of communities are creating awareness in relation to the green ribbon. And indeed, if any of you here on the call would like some green ribbons, we have some of those cardboard big ribbons as well, if you'd like to do a photo op, and if you want to do that in your own organizations and then just post it on your social media platforms, please do contact us in relation to that. And then the next slide is just some events that we have been involved in recently, just in relation to promoting World Suicide Prevention Day and also the Green Ribbon. The first one there is I've taken of me on Monday. I was in the foyer of the Mullingar, or the regional hospital in Tullamore. And in conjunction with the communications officer there, we had to stand and interacted with all the staff and all the public there as they came in for all their various appointments. Under that then is an event, a photograph that was taken at an event that Rosaleen held in Dundalk last January. It was a community wellbeing event, and our head of service there, Dervla Ayres, and Kathleen, one of our SBLOs, is there in that photograph as well. On the left then is a photograph that Patrick took yesterday when he was doing a presentation to all the Tusla social workers. And as you can see, the green ribbon is propped up there in the middle of them. And on the bottom then, under that on the left, is a photograph of an event that we held in Tullamore Court last year, networking event just after COVID, bringing everybody back into the room and creating that integration again between partners and everybody getting to know each other again, and setting a focus for what was going to be our work for the following year. So that's me. That's all I have to say to you. I'm going to hand over to Rosaleen now. Thanks, Rosaleen.
Okay, thanks, Josephine. You can see up there the next message is, what can we do to keep you safe for now? So ultimately, everyone can make a difference in preventing suicide. And the more people in the community who have suicide intervention training, the more likely it'll be that they'll identify someone who may be vulnerable and intervene to help keep them safe. So to assist with this, and as part of Connecting for Life, we offer evidence-based training. And the aims of the training is to enhance awareness and develop skills to respond to suicidal and self-harm behaviour. So I'm just going to talk you through these really quickly. The Live and Work Start program is an online program that teaches participants to recognise when someone is thinking about suicide and how to connect them to help and support. So it's a 90-minute self-directed learning program. Safe Talk is an internationally recognised half-day face-to-face training program. So it supports participants to recognise and engage persons who might be having thoughts of suicide and to connect them with community resources or supports. Then with regards to understanding self-harm, there are 2 courses here. There's a 2-hour online introduction course and a 1-day workshop that helps participants to develop knowledge and understanding around self-harm and then consider the needs of those who are self-harming. With regards to ASSIST then, it stands for Applied Suicide Intervention Skills Training, and it's a 2-day skills-based workshop that equips participants for a suicide intervention role. So the emphasis is on first aid. It's about helping a person who may be having thoughts of suicide to stay safe and seek further help. Then the suicide bereavement training is offered to professionals and key contact people in the community to understand the grieving process in the context of suicide and the key elements to support someone who's been bereaved by suicide. And then finally, the STORM training is a skills-based training program of risk management for suicide prevention. It aims to develop the skills of frontline workers in mental health services to assess and manage a person at risk of suicide. So just on the next slide, you'll see the 2 links there. So all of the training is free of charge. It's fully funded by the HSE. So all those wishing to register for training, whether it's online or in person, can book through the BookWhen system. And they are the 2 links there. And just to say, to organise in-house training, the cost of training again is free of charge, but we do ask for a minimum of attendance of 20 participants. Okay, on the next slide then, you can see some of the resources there, which we'd be happy to send out to anybody who would like them. So just contact your local resource officer if you do want the little postcards or the any of the other resources that we have as well. So we're also currently developing a key ring and a QR code, and people will be able to scan the QR code to give them information on training and resources. Just on the next slide there, you'll see that the revised information and signpost and postcard is now available, and it contains a QR code linking directly to the BookWhen website for all suicide prevention training programs. So for copies of these, just link in with your local resource officer again. All right, on the next slide then, you can see that we're just going to say a few words with regards to language. So you may have seen the piece with regards to words matter in the World Suicide Prevention Day newsletter that went out last week. So we need to be mindful that people here will have been impacted by suicide in some way or another, either professionally or personally. So it's really important that we use sensitive and non-stigmatizing language when discussing suicide and self-harm. So we should try to show compassion and respect and remain not judgmental and try not to make assumptions about other people. We should use neutral and simple terms, and one way to do this, if we're talking about suicide, would be to use the words die by suicide rather than committed suicide. So it's important not to identify a person solely by their mental health difficulty and never use suicide as a noun to describe a person. So we wouldn't say it was suicide. We might instead say a person died by suicide. And you can see some of the other alternatives there on the slide as well. Okay, I'm going to hand you back to Patrick now, and he's going to tell you a little bit about the development of the leaflet. Thanks, Patrick.
Thanks, Rosaleen. Good morning, everybody. Thanks for joining us this morning. I suppose the purpose of today is to launch this leaflet, it's a new leaflet that's been developed with our colleagues in Pieta and our colleagues in An Garda Síochána. And I suppose where this the idea for this leaflet came from is when I was linking with guards in Moat when I started in the post, where they were supporting a family where there had been a suspected suicide, and the Garda on duty at the time, he knew there was information out there in relation to supports and services, so he was then trying to find that information. So there was a number of services and a number of leaflets. So in linking with our colleagues in Pieta and with them, I have to acknowledge Sergeant Alison McCabe from Garda Station organisation who was a big part of developing this leaflet, and she couldn't be here this morning, we decided to have a one-stop shop with all of the information that was required in the Midlands and in Louth Meath for this the supports that are available to an individual who has lost somebody through suspected suicide. So I'm not going to go into detail around the SBLO service because we have Bernie and Kathleen on this morning, and they're going to speak about their role and the support that they offer. But in terms of the leaflets, this is the leaflet that was for the Louth Meath area, and it identifies Kathleen and Rosaleen. So Kathleen's contact details are there, and Rosaleen's contact details are there. And Kathleen and, as I said, Bernie are going to speak about the ROSP role, and it's kind of identified on the leaflet, and then the joint role that the SBLO and the ROSP can take in supporting a community where there might be a risk of contagion or where there's a kind of a higher level response required. It might be a community response, bringing maybe a number of services together, a number of community agencies together, such as GAA teams and different pieces to talk about supports where there has been a suspected suicide within that community. This is the leaflet that's there for the Midlands, so it has Bernie's contact details and it has Josephine's contact details and my contact details. And I suppose the difference really between the ROSPs and the SBLO service is that we provide that resources, so the resources that may be required by that family at that time, where it's a guide. There's a number of guides and support information leaflets that are there for people who are bereaved by suicide, supporting somebody bereaved by suicide, supporting children and young people who are bereaved by suicide, and that you are not alone, which is a key book. That I suppose it takes care of practical matters. It explores how you may be feeling, your connection with the person who has died, getting through and creating a new future, and help and support. And enough of these resources are text heavy, so we wanted to have a smaller version of a leaflet that would give that information at the time to the family, to an individual, where they're not overwhelmed with information, but they would have the key documents that are there, but also would have the contact details for those out of our supports that are available to them. And one of the pieces that Sergeant McCabe was key to include in the leaflet was the contact details of person providing this leaflet, so that if there's a Garda on duty in a station and they get the call, they're going out to a family, they can leave their name, their station and their contact number, and the same for any professional then who is going to be working with that family, so the family knows who they can liaise with, maybe if they want to get more information or if they're having ongoing support from that service. So all of these, we've started, I suppose, dropping these leaflets out to various Garda stations and different services and stuff. So if you want copies of these leaflets, we can forward those leaflets to you, or we can arrange to have them dropped out so you'll have that information at hand. And I suppose the importance of this leaflet is that 9 to 5 all the services are available, but we all know that those crises and those calls usually come maybe on 11 o'clock on a Friday night, when there's limited services available. So by having people having accesses to that information, they'll be able to provide that support until more services are available in the following week. And that's particularly important for our colleagues in Garda Síochána, because they're going to be taking the out of hours calls, they're going to be there at the weekend, so it's important that they have this information. Partnership working is important for I suppose the HSE, and we fund a number of agencies, and I suppose what we would recommend is that any services that are offering support in the area of suicide prevention and mental health, that if you just check that they are a HSE funded or supported approved agency before that information is provided to an individual or a family. So I suppose we will send out copies of this presentation, and so if a service is offering support, I suppose it's important maybe to check that they are part of a HSE funded and approved service, because I think it's important that the family, as Josephine alluded to under the 7 goals, that there's a quality response. We can stand over as ROSPs and from Pieta of any of the services really that we engage with, that there will be a quality response. But there are a number of agencies working in this space who are maybe doing good work, but I suppose we haven't got oversight of their governance and their support going forward. So it is important that you do check to make sure that you're offering the right support at the right time, and that it's an approved support. So with that in mind, I'm going to hand you over to our colleagues Bernie and Kathleen to talk about the SBLO service and the work that they do and support that they provide. Thank you.
Thanks, Patrick. Hi everyone, I'm Kathleen. So I'm the liaison officer in Louth and Meath. and I'm lucky to get to work with Rosaleen a lot. So it's nice to see the two of us on the leaflet. We're famous. But I'm just going to outline a little bit about what we do in the liaison service in case people don't realise what happens with us. So I suppose our aim is to provide a prompt and proactive response in the aftermath of a suicide in the community. So we would work closely with first and second responders, and what we aim to do is also provide, and Patrick went into it a little bit there about the community responses, and we get, I suppose, requests from, I suppose, GAA clubs, workplaces, and from an SBLO point of view, I suppose what we want to do is provide information and support and kind of an understanding of the grieving process in connection with the death to suicide, you know, and normalising feelings and providing support for people in the community. We provide one-to-one support, family, group support, and in addition, we provide telephone and online support as well. So I suppose, what does that mean? I suppose what we do is we can meet with the bereaved in their home. We can meet with them in a Pieta centre or a place that best meets the needs of that client in particular. So we really try and tailor make it for our families that we're working with. So what are we doing when we go out to meet people? I suppose we're normalising feelings, we're building relationships, we're getting to know that unique person that's lost their loved one, so that we can tailor make supports that work for them in the community after they've finished with us. So we can provide up to 10 sessions for that family or individual, and then what we're looking at really is kind of collaboratively working with them, getting to know them. What's the best onward support for you? That could be back into Pieta for 20 free sessions of bereavement therapy, or it could be a group. We work closely with Hug. Some people would prefer to connect in with people in their community that have experienced this kind of loss. It could be connecting in with, I know, like the family resource centres are providing counselling as well, and sometimes that can be easier for people if they're already attending that centre for other things like childcare and information and education and things. So it's really about us supporting that individual person in finding what's the best way forward after they finish with us as well. And I suppose what we do also is provide practical support needed by bereaved people with the relevant services for information. Like, it could be regarding finances. In that case, we'd be linking in with people like MABS. It could be the guards, also the coroner. As you know, people who are bereaved by suicide have to go through that kind of traumatic piece that we don't normally have to go through when we lose somebody, which is provide statements, go to coroner's court, the inquest. And I know myself and Rosaleen have met the coroner up in Trim as well, and they're very open to us working with them so that we can liaise with them on behalf of families, and that really, really helps the family to feel calmer about this part. There's a lot of feedback on the line.
There's a lot of feedback there. I think maybe if everybody mutes their...
Oh, it's gone now. That's better. So I suppose providing that practical support around inquest as well. Inquest generally happens 6 months to a year after a suicide has happened. So even if the family will have moved on from ourselves as liaison officers, they can link back in with us and we can support them around that time as well. A lot of the work as well is providing knowledge and information on how best to support children and young people who have been bereaved, and also, I suppose, supporting families, parents who would like to be able to tell their children the truth about what happened to another parent. And that can be challenging but very rewarding to try and support parents in being able to do that. We also provide advice on referral pathways, as I said, going forward, and we base that on getting to know that individual family and that person. So who do we support? We support anyone that's affected by a death by suicide, to be honest. But I suppose my experience thus far is that, you know, families in Loudmead at the moment seem to be connecting in pretty early. You know, so between kind of 3 weeks to 6 months, and that's just in my experience thus far. And I suppose we have a unique opportunity there as well. All the liaison officers are fully accredited therapists, although we're not providing therapy in this role. So we do have an opportunity there once we have built that relationship with the families and individuals where they feel safe enough to be able to tell us their real thoughts. And sometimes, unfortunately, that can be that I'm having suicidal ideation myself. And I suppose we're in a unique position to be able to sit with that and to be able to talk through with that person and to be able to provide and refer into our intervention services in the wider Pieta. So, and that's something that's, I suppose, even though we're post-vention, the intervention piece is coming up all the time too. So I think I've covered it. We do lots of other things, I suppose, as well. Networking, meetings on steering committees, you know, so it is a diverse role, which is great. So if anyone has any questions, I'll try my best to answer them. I'm sure Bernie would hop in as well, being the more senior of the two. But yeah, thanks so much. I hope that provided you with enough information about the role.
Thank you, Kathleen.
You're welcome.
And thanks, Bernie, for joining us. Bernie, you've avoided sending on a photograph to me, so I'll have to get you captured at some stage now with a picture.
How did I miss that one? I wonder, Patrick.
I know. I may screenshot you at the moment and include you in the presentation going forward. But look, Grant, thanks a million, everybody. We've said we want to keep you for half an hour, but we would like to allow some time for questions if anybody has any questions. But if you don't have any questions, what we can do is that if you email your local ROSP, if you're looking for the copies of the postcards and if you're looking for copies of the leaflet, we can arrange for them to be sent out to yourselves. So I'll just kind of, I suppose, open up the floor there if anybody has any questions.